Good morning, everyone, and welcome back to Hocking Valley Community Hospital's 55th anniversary celebration. These are our 55 ways to become a better me in 2021. So hopefully you've been following along with us since January. We've been doing this. Special guest with us today is Julie Grow. As you can be assured that we do have the experts speaking on the topic of the day. So Julie Grow does have a bachelor's in health administration. She has her master's in business administration, over 20 plus years in healthcare experience, the last 8 of which has been as our chief financial officer here at Hocking Valley Community Hospital. So welcome, Julie. She's going to be speaking with us today on the focus on financial health.
Just wanted to take some time today because financial health is an important component of our overall health. And the way that Hocking Valley tries to assist our patients is through our different discount programs that we offer here at the hospital. There are some things that you have to do on your end and things that we require to get on your behalf to assist you with these. So we're just going to take some time today and go through each of those different discounts that we offer and give you some information on whether or not you would qualify. First, a discount that everyone qualifies for, regardless of your income or what you make, and also requires the least amount of information from you, our patient, is the prompt pay discount. And the way that you are able to take advantage of this, it does not require an application. You simply have to pay your amount due in full, and then you have to pay that within the first 30 days of receiving your first statement. So once your insurance is processed, if you have health insurance or you get that first bill, if you bring that in within 30 days of that statement date and pay it in full and don't engage in a payment plan or that kind of thing, you get a 15% discount. The other important piece to note is that this can also be stacked with other discounts that the hospital has. So with our charity applications or financial applications that we're going to go through here in just a minute, we have the ability to qualify you for a financial aid discount that may be 25, 50, or 75%. And then whatever balance is left at that piece, if you pay that amount in full, you get a 15% discount on top of that. So it really can add up to quite a bit of savings.
After all these discounts, does that apply toward my out-of-pocket deductible?
Absolutely. So that's the other good piece to this, and this can really add up. Let's say you have $1,000 deductible with your health insurance plan. That is no longer unheard of anymore. The deductibles are getting higher and higher. So for the sake of easy math, if you have $1,000 deductible and you want to pay, you get your bill, you're responsible for your full deductible, you've been lucky and haven't had to use your health insurance earlier this year, and you pay that amount in full, you would get $150 off of that bill. Okay. So you would only pay $850 of the $1,000. However, you've met your deductible. So we're not going to then, your insurance doesn't still come back and say, well, you've only paid $850, so now you have to pay $150 more. So that $150 discount still goes towards that deductible. Okay. The other example, as far as stacking goes, let's say you have that same $1,000 deductible, and farther down into the conversation, you filled out the financial assistance application and you qualify for a 50% discount. So you're only responsible at that point for $500. You can then take that 15% discount off of that $500 as well and save another $75. So these savings can really add up if you just work with us and get us the information that we need. Another discount that we offer that we try to work with our patients on is we don't ever want a patient's hospital bills to eat away and to take up the majority of their income. This is also available to all of our patients, regardless of income. Your income does come into play with this, so we do still need those that application and need to work with you. But we try to make sure that your health and costs from Hocking Valley are not greater than 30% of your income. So what we do is have you fill out the application and work with you. And again, for easy math, let's say your family income is $100,000, then we try to make sure that your health bills aren't more than $30,000, which that's a lot, but just for the ease of showing you, we would take it down to that 30% of your income. Um, and again, this is another one that can be stacked with other discounts as well, but we take those balances down to not exceed 30% of your income. The next, and probably the most widely known of the the discount plans that we have, and this is actually one that's also offered all across the state at all of the hospitals, is the Healthcare Assurance Program, which we often refer to as HCAP. This one is only available to those patients whose federal poverty level income is at 100% or below. And we'll go through those and what federal poverty level means just here in a minute. But if you are at 100% of the federal poverty level with your family size, and you can even have insurance with this, then you will get a 100% discount off of your bill. So we'll write the remaining balance off. So whatever insurance is processed and left you with, if it's that $1,000 deductible that we referred to before, you will not be responsible for any of the bill. So this does, however, require a little bit of work on your part. And I know that sometimes this can be frustrating for patients, but it's really worth it in the end. So we do need you to fill out the application. So that's the first piece. And then we also need proof of income and proof of your assets. Income is at 100% or below. And we'll go through those and what federal poverty level means just here in a minute. But if you are at 100% of the federal poverty level with your family size, and you can even have insurance with this, then you will get a 100% discount off of your bill. So we'll write the remaining balance off. So whatever insurance is processed and left you with, if it's that $1,000 deductible that we referred to before, you will not be responsible for any of the bill. So this does, however, require a little bit of work on your part. And I know that sometimes this can be frustrating for patients, but it's really worth it in the end. So we do need you to fill out the application. So that's the first piece. And then we also need proof of income and proof of your assets.
So exactly proof of income and assets. I know we hear about that a lot, and I oftentimes think about an elderly person and maybe that's a little confusing to them. What exactly am I going to need to bring in with me?
Sure. So proof of income, if you are employed, you would need to bring a copy of your most recent pay stubs. So whatever you're getting from that employer. Let's say you're retired and you're on Social Security or you're disabled, that monthly award letter that you get from Social Security that tells you how much you will be receiving each month would also be a proof of income. And then we also have folks who are self-employed and don't necessarily get that pay stub every couple of weeks. So we also would accept a copy of your tax return. So that could also be a form of proof of income. The other piece with the proof of assets, and this is something that, patients can get frustrated with having to share, but it's just with so much fraud and abuse in the world today, we have to basically, require this information. And because we're audited on our processes and how we're collecting this data and if we're, applying our policy correctly. So that's one way that we do this. And so a proof of assets, we don't need to see, your home, your, all of those intangible things. We're looking more for your current things. So a copy of your bank statement to show, what you have available or accessible to you. That also helps us verify those deposit amounts with your Social Security deposit or with your, your pay. So that helps us, we're looking for those things. We would never share that information outside of our financial assistance. The gal that processes those applications, we have to hold that to the same level of privacy that we do your health information as well. But those are a couple of things that we do require. But again, that savings is definitely worth it in the end to take those couple of extra steps. Moving on, so that was a federal program that's offered at the federal level. The hospital also a few years ago recognized that that still just didn't capture all of the need in the community. And so we implemented our own hospital-based charity application or program to kind of go along those same lines and implemented a sliding scale. So with that, it's available to patients who make 101% and up to 400% of the federal poverty level. So that broadens that discount. You can have insurance or not. Several years ago when we first started this process, you had to have insurance to qualify for this program, but that is a change that we made a few years ago to try to open it up to additional folks. You do have to fill out that same application. We can get that information to qualify you from the same application with the HCAP program. We try to make it simple, and you do have to provide that same proof of income and proof of assets.
After having said all of this right here, at the end of the day, how do I know how much of a discount I really get?
Sure. So let's take a few minutes and we'll go through the income guidelines and how that sliding scale works. So that leads into my next slide. So 100% of the federal poverty level, and these amounts change every year from one year to the next. Sometimes they can go down, which I've seen over the past 20 years, but most of the time they do go up. And this is something that is dictated at the federal level as far as what these poverty levels mean. So it's based on family size. And for the HCAP program, if you are a family of one, you're a single individual, not married, no children, your income would be $12,880. And a good example, typical family of four, husband, wife, 2 kids, the total income for the family would be $26,500. This would qualify you for a 100% discount through the HCAP program. But then moving on, with the hospital-based charity care and that sliding scale that I mentioned, and this is a little bit more to digest and a little bit larger of a graph, we have increased those income guidelines. So that same single individual who not married, no kids, can make $25,760 or less and still qualify for a 100% discount of their care. Same family of 4, husband, wife, 2 kids, can make $53,000 or less and qualify for 100% discount. So this broadens that HCAP program and takes it to another level to take that income up to about 150% of the federal poverty level.
Julie, you've mentioned the word family there 2 or 3 different times, in this last slide that you've been showing. Tell me exactly when I'm talking about my household and family and everyone living there, and I'm using my dad as an example, having my mom just passed away. If my dad moved in with me, what are you considering family and living in the household? Is that everyone there? Is that just my children, my spouse? How, just for clarification?
Well, and unfortunately, this is somewhere where the federal guideline and the federal definition of family hasn't really caught up to the modern family, so to speak. We have many blended homes. We have, grandparents raising grandchildren and all of that don't necessarily have legal custody of those children sometimes. So this can actually be a lot more watered down and confusing than some people could even imagine. Because unfortunately, the definition of family is, a legally married spouse. So if you are not legally married, then that does not count towards a person in your household. And then children who are adoptive or natural born to you and under the age of 18. So that being said, if I'm the patient and I have stepchildren, those don't count towards my family size. The other piece to that is if you have natural children that you do not have custody of, you cannot count them in your household either. So this definition can actually be pretty difficult sometimes, and we can help you, come up with that. The other piece is, like I said, the grandparent who doesn't have legal custody of those children can't count that child as a family member. And then, as you mentioned with your father, having him in your home, if you're caring for him and you're providing the benefit for him, he's a family of one if it's his specific bill, but you could only count you and your husband. You wouldn't be able to count your father as a part of that family because he's over the age of 18. So this is an area that can be very confusing. As I mentioned, at the federal level, they just haven't really caught up with what the modern day family looks like. And that can be frustrating for both the patients and for us when we're trying to qualify, because we recognize that is somebody you're providing support for. And so it can be kind of frustrating sometimes.
Thank you for that.
Uh-huh. Moving on through this, so moving on to the next column, you'll see the 75% discount. So we'll take, if you owe $100 and you make $32,000 even for a year and you're single, not married, you would get $75 of that 100 written off. So you would only owe $25 at that point. And then moving off onto the right, 50% discount, a 25% discount, that if a family size of one could make $45,000 and still get 25% off. So that's still $25 off of that 100 that you've saved by taking the steps to fill out that financial aid application. And then looking at a family of four, that's a $92,000 income for a husband, wife, and two kids that could make $92,750 and still get at least a 25% discount. The other thing, the mission of Hocking Valley Community Hospital is to care for our community and to make sure that we're providing, the much needed care in our area. And so we felt that it was important. We recognize, we've lost close to 10,000 industrial jobs over about the last 15 to 20 years. And with that went a lot of health insurance. And then you have, on top of that, these deductibles that are in out of pockets that just keep rising and getting higher and higher. We live in an area where we picked ourselves up by our bootstraps, and we held on to the tourism that we have here. But a lot of that results in individuals who are either uninsured or underinsured in our community. And because, it's a lot of these small businesses and people who are, they used all of their resources to put food on the table and do away with these industrial positions and find a way to make ends meet. But health insurance just isn't something that's really strong and prevalent in our area. So what we did to try to help alleviate that is, if you are a Hocking County resident, we extended that income to extend that 25% discount out to an even higher level of income to try to capture as much of the community that we possibly could. And in doing that, if you're a Hocking County resident, it actually takes you up to 400% of the federal poverty level. So that family of four can make $106,000 and still get 25% off. So I encourage everyone to fill out that financial assistance application. I hate, and I wish we could change the name of it and change the mindset of everyone that the word charity is in there, because it's not charity, it's a discount. So I think that's one of the other important pieces that I try to communicate out when I'm talking about our financial assistance programs is, it really benefits you to take the time to fill out these applications. So I worked through and I talked with our financial aid counselor who goes through these applications, and talked with her some this week and said, help me, what are the questions that you get the most? And what do you often hear? So just want to spend some time going back and forth with you, if you don't mind.
Great.
If you'll hit me with the question, and we'll go through each of these answers.
So tell me, where can I get an application? If I, just listening to your information there, it does encourage me to want to, to look at that, or my family and my friends. So where would I start? Where do I get an application?
Turn your statement over. Every single statement that we send out has a copy of the financial assistance application on the back. So if you turn that statement over, you can start there and fill it out. You can also initiate that from the very beginning of your visit, and you can get those at any of our registration areas. So they have copies of the financial assistance application as well. Our business office that is located in our purchasing building, and the building off to the side, if you're facing the hospital off of 664, the building to the right, is where our patient accounts department is located, and they have applications there as well and can help you fill them out. So we can also direct you to our website, hvch.org, and there is a application on our website as well.
Now, on that same bill, if I get my bill, is it going to tell me where I need to send that application?
Sure. It tells you can bring it back to the hospital, to any of the registration areas as well, or the business office. So you can personally deliver that if you have any additional questions or want to make sure that you filled it out correctly. Or you can mail it back to us at P.O. Box 966 in Logan, and that is on the application as to where to return it as well.
Now, how can I know if I actually qualified for that discount? The numbers sound good, but how do I actually know? How long does that take? What's the process on that?
Sure. Maximum, I would say, typically you will hear a response within 30 days. Amy Douglas is our financial aid counselor. She is amazing at getting this information processed and getting it back to you. And typically you'll have a response back within about a week. We mail a letter to you, to your residence that is associated with your visit. So we'll mail that response back, whether you qualify or not. So even if you don't qualify for the discount, you will get that letter back stating that it was denied. And then if you do qualify for a discount, it will let you know how much. So if it was 100%, you'll know that you don't owe anything at that time. If it's a part of the sliding scale, let's say you owe 50% or whatever, it'll let you know that information as well.
And we all know filling out these forms can always be complicated. Certainly probably going to have some questions. Where would I call for that?
Sure. So you can always call the 800 number that is on the statements with our billing department, and they can help you. As I mentioned, you can stop in to any of the registration areas. They can help you. And then I also mentioned Amy Douglas, our financial counselor, before. She is great about helping folks get these filled out. Sometimes she can catch the questions. If she has a completed application, she may be giving you a call to proactively ask. But then if you have a question, you can call Amy Douglas at the hospital, and she can be reached at 380-8090, or just call the hospital operator and ask to speak with the financial aid counselor.
And I can just use my mom as an example, just having, been in the hospital herself. You do get multiple different bills that come from different things. Does this all apply to everything? How does that process work as well?
Unfortunately, it doesn't. You could possibly get 2 or 3 bills if you have a hospital visit. And this isn't just at Hocking Valley, this is at other hospitals as well. So let's say you end up in the ER. So you have that ER physician bill. that comes from our physician providers, and you have the hospital bill. So that would be two separate bills. This application applies specifically to us. I do have, however, encourage everyone to call those additional providers. Some of them honor our financial aid discounts, some of them do not. It's just dependent upon, we have no control over that, unfortunately, and it's just dependent on one provider to the next. But it's absolutely definitely worth the call. The other piece I will say to that is, my mother was sick a few years ago and before she passed away. And one of the things that I told them was, please, please, please do not pay a bill until I've looked at it and I've had a conversation. And we saved them thousands of dollars by filling out these applications, because Hocking Valley isn't the only hospital that offers these type of discounts. Most generally, every hospital offers some type of financial assistance. So especially if you have some type of chronic or long-term health event or serious health event, I encourage you, not just at Hocking Valley, but at any hospital that you receive care, to take the time to do this, because you're talking a significant amount of savings that you could have on your healthcare costs if you proactively own this process. And I encourage you to ask questions, to call, and to be proactive in working with the organizations, because the last thing we want to do is to report this on a patient's credit, or to send somebody to collections. So if you're actively engaged and involved in this process, we can help you. We can answer as many questions as we can. We can help you work with the other facilities and other providers and seeing if there's some type of discount there. But each hospital or each organization, each provider has their own application. But I encourage you to reach out to all of them.
So let's talk a little bit about the time period. Once I or my father or whoever fills out that application, is that for like the year? Is this for like 2021 and I do it again in January 2022? I'm sure there's a time period or something there, if you can talk a little bit about that.
Sure. Most generally, those applications are good for about 90 days when it comes to an outpatient visit. So it isn't something that every time you come in or every time you have a visit that we are going to require you to fill it out. That information usually lasts from 90 days from the time of the visit. However, with an inpatient stay, we are required to obtain that information more often. So that typically pertains to the month of the visit. So if you were an inpatient in April, you fill out an application and you're an inpatient again in May, we would need an additional application for that inpatient stay in May. But if it's an outpatient visit, it's generally every 90 days.
Talk to us a little bit about if someone does come in, does apply, but unfortunately doesn't qualify, but still their life circumstances does not allow them to be able to pay that bill in full. What happens then?
Sure. As I mentioned, it's not our goal to send somebody to collections or to ruin someone's credit, or we just don't want to do that. But we need you to be proactively involved in your care, and that includes all the way through the continuum from start to finish. So reach out to the hospital business office or to the financial aid counselor or at the admitting desk. And we can set you up with payment arrangements and set you up on a payment plan. And as long as you are making payments towards that bill on a regular, timely basis, that will not affect your credit, not affect, any of that. It will stay with the account, will stay with the hospital, but we need you involved in that care. So we don't send anybody to collections until they've received at least 3 statements and at least 90 days from the time their insurance process. So that gives you some time to either pay the account in full or to set up payment arrangements with us. Unfortunately, you wouldn't qualify for the prompt pay discount if you do set up payment arrangements. You wouldn't get that 15% we talked about at the beginning of our conversation. However, when the hospital arranges a payment arrangement schedule, we don't charge interest. So you forego that discount, but then you're not getting interest charges like you would a credit card where you feel like you're never making any headway. And these payment arrangements can also be used. Let's say you have that $1,000 bill that we talked about because you have a high deductible, and you qualify for a 50% discount. So you're left with $500 that you still need to pay. $500 is a lot. So if you still need to make payment arrangements on that remaining amount, we can set up payment arrangements for you for whatever that sliding scale amount is, the remaining that you owe as well. But our goal is to work with you in any way that we can, to help make this as painless as possible. But we really need the patient's help with this and to be proactive and to get involved. I appreciate you having me today. Do you have any additional questions that we didn't think of, or
This was great information. Just sometimes I think maybe people are afraid to ask or don't know where to start. So this was just a lot of good material, a lot of good stuff today. So we're just grateful to you for joining us as well. Anything else you might want to share?
No, like I said, I highly encourage everyone to be proactive, to fill out that application, to see if they qualify for a discount, because it can really add up to some savings, and financial health is just important in the overall health, and in any way that we can be a part of that, we're happy to help.
Well, thank you again for joining us, and for you listening and watching us today. Thank you again for joining us, and follow that number that Julie gave us if you have any questions about your bill or how to apply for the assistance program as well. Thank you again, and join us next time.
Thanks, Latricia.